Breaking news update coming in, and the day after sent informed the parliament that none of the states had reported oxygen deaths. Now a contradiction has emerged from Tamil Nadu. Now the Tamil Nadu Health Secretary has said that there were no deaths due to shortage of oxygen in the state. However, an earlier letter from Chief Minister M Stalin on May 7th to the Prime Minister had mentioned 13 deaths due to oxygen shortage in Chengalpettu. For more on this, let me go across to my colleague Mugilan for more details on this. Mugilan, so this seems to be a clear contradiction coming in from Tamil Nadu on the oxygen-linked deaths, because earlier Stalin had written a letter to the Prime Minister saying there are 13 deaths which are due to oxygen shortage in Chengalpettu. Now the Health Secretary seems to be contradicting what the CM had said.
Definitely a glaring contradiction coming from the Health Secretary and the stand taken by the Tamil Nadu state government earlier, because we have seen during the peak of the second wave how Tamil Nadu was suffering due to oxygen shortage, and we have seen the kind of actions and the efforts that have been put in by the Tamil Nadu state government to source oxygen not only from within the country, they even exported oxygen and other related oxygen cylinders from the other countries also. And Chief Minister, in his first letter to the Prime Minister, he has very clearly noted that, and I'm quoting the letter the Chief Minister written to the Prime Minister regarding the oxygen shortage. He says that the availability of the oxygen in Tamil Nadu is very critical, and there was an unfortunate incident of 13 deaths at Chengalpattu 2 days ago. So the Chief Minister has pointed out the death of 13 people in the Chengalpattu hospital due to oxygen shortage. But now we are getting a reaction from the Health Secretary stating that there was no deaths due to oxygen unavailability in the wave 1 and 2. And it is very important to note, and we are trying to get a version from the health department officials also, whether the death due to lack of availability of oxygen was a cause of death that has been given in the guidelines by the central government, and we are trying to get that clarification from the health department.
Right, exactly. I mean, because this is, of course, something which is contradicting the head of the head of the state in that sense, the Chief Minister of the state being contradicted in a way by the Health Secretary. Now we'll, of course, have to see what more details are coming out from this. Mugilan, thank you so much for joining us with that.